contains the heart and all of our blood vessels, both arteries and veins. The key function of our cardiovascular system is pretty simple. We have blood that we need to move around our body because that blood does two very important things. Number one, it delivers oxygen and nutrients to the tissues of the body. The second thing that we transport in our blood are waste materials and carbon dioxide, of which we need to get out from the tissues and bring to the lungs. We utilize our cardiovascular system to do this. The heart pumps blood through our arterial system. We then bring blood back to the heart via our venous system. And in doing so, we move oxygen, carbon dioxide, nutrients, and wastes. Also moving within our cardiovascular system are the hormones produced by the endocrine system we just talked about. Also within our blood system are the white blood cells and the platelets. The white blood cells allow for us to fight infection and disease. Platelets help us to clot our blood when we have some sort of bleed. Red blood cells are what we use to carry our oxygen and carbon dioxide. So when we think about the cardiovascular system, again, we're thinking about the heart and all of the blood vessels. When we get to this chapter, we're going to talk extensively about the parts of the heart. We're going to show you all the blood vessels that lead blood down into the forearm, all the way down into the lower leg, all the way up to the brain, into the kidneys, things of that nature. Lymphatic system is next. The lymphatic system is connected to our immune system. So when you think lymphatic, also think immune system. Our lymphatic system is a series of lymphatic vessels that ultimately take a portion of the fluid that surrounds our cells, which is brought there by our circulation, and it brings it into the lymphatic system. And in doing so, it tests that fluid for the presence of anything that doesn't belong in the body, whether it be a virus, a bacteria, a fungus, cancer cell, whatever. And it does so, it tests this fluid by sending it through specialized structures called lymph nodes. And we all should have heard of a lymph node, right? We know we have a lot of lymph nodes in our neck, we have lymph nodes in our underarm, we have a lot of lymph nodes in our groin. Our intestinal system is surrounded by lymph nodes. And the job of these lymph nodes is to filter this material, trying to detect anything that doesn't belong in the body. And if we find something that doesn't belong, we trap it, and we create an immune response to it, so that we can fight whatever infection, bacteria, virus, what have you, we find in the body. Our lymphatic system also houses the cells that we utilize to fight infection, namely our white blood cells. So when we think about our lymphatic system, we're talking about an organ system. It looks very similar to the circulation in that it's a series of vessel-like structures that transverses throughout the whole body. Again, filtering ultimately the blood. It's not quite accurate, but for our purposes right now, we filter the blood, looking for anything that doesn't belong so that we can create an immune response. This is how we get over infections and what have you as we get sick. The next organ system is our respiratory system. Now we're talking about our lungs, we're talking about the pharynx, we're talking about our nose, we're talking about the trachea and the bronchi. A series of organs shown here that allow for us to bring oxygen into the body and get rid of carbon dioxide from the body. So the main function of our respiratory system is to introduce oxygen into the body so that we can bring that oxygen into our bloodstream. We use that oxygen to feed our cells because our cells need oxygen to function. We got to get rid of carbon dioxide, which is a byproduct of cellular metabolism. We also use our respiratory system for vocalization. Our ability to talk is because we can use our vocal cords, which are part of our respiratory system. When we think about the respiratory system, we have our nasal cavity, starts in the nose. We then have the pharynx, which if you poke your If you put your finger to the back of your throat, that you're touching your pharynx. That's a tube that connects the nose and the mouth down into the larynx. The larynx is in the front of our throat. This is where our voice box is. Anybody who has an Adam's apple, that's the front of your larynx. The trachea is the tube that takes air down into the chest or into the thoracic cavity. Once there, it splits into a left and a right bronchi. Those bronchi are what ultimately pierce each of our lungs. And then the lungs and the structures of the lungs are where we actually exchange oxygen and carbon dioxide with the bloodstream. Our digestive system is next. When we think of our digestive system, we're talking about our mouth, the esophagus, stomach, small and large intestine, and our rectum. Our digestive system actually is pretty complex. It has a lot of different functions. One, we have to ingest food. Our body can't produce all the nutrients it needs to survive. We actually have to provide our body with its needed nutrients. We do so through eating and drinking. But the breakfast that you ate, or the lunch that you're going to eat later, or the dinner that you're going to eat tonight, as its form is, unless you drink nothing but a shake, you have to be able to break down that food into a more microscopic chemistry for us to actually be able to absorb it and use it. Our digestive system does that for us. The food that we eat, we ultimately swallow bite-sized chunks of it, bring it into the stomach. Our stomach then is going to turn that food into a liquid. That liquid is going to get dumped into our small intestine. Our small intestine is going to reap from that food all the nutrients our body needs to survive, namely carbohydrates or sugars, proteins, fats, vitamins, and minerals. And those are the 5 key components, along with water, that our body needs to survive. We're going to take those nutrients, dump them into the bloodstream, and then the bloodstream will deliver them to all the parts of the body where they're needed. Whatever is left will get moved into our large intestine, and our large intestine will then take water away from it, and then what we're left with is a semi-solid waste material, which we call fecal matter, and we defecate that utilizing the rectum. So the job of the digestive system is to ingest food, be able to break down or digest that food into smaller components, be able to absorb the minerals and materials out of it that our body needs to thrive, and then defecate and get rid of whatever's left as waste material. Our urinary system, 2 more. The urinary system is composed of 4 key organs. We have our kidneys, we have our ureters, we have the bladder, and the urethra. The job of our kidney, first and foremost, is to produce urine. What we do in our kidneys is we filter out our blood. Any waste material that might be floating in our blood, which is always an abundant amount, our kidneys filter that material out, and we turn it into urine. That's the job of the kidney. That urine, once produced by the kidneys, will be transported to the bladder via 2 tubes called our ureters, which connect the kidney to the bladder. Our bladder is nothing more than a holding vessel. It stores urine until such a time as enough urine is produced that we feel the urge to pee. Our bladder stretches, enough pressure gets placed upon our bladder that you feel the urge to urinate. We then use our urethra to transport urine from the bladder to the outside world. By and large, the key function of our function of our urinary system. Then last but not least is our reproductive system. This will be the last chapter we talk about this semester. Our reproductive system, obviously now we're going to have to talk about the difference between men and women. With regards to men, we're talking about the testes, we're talking about the vas deferens, we're talking about the prostate, we're talking about seminal vesicle, we're talking about the urethra, we're talking about the scrotum, penis, different organs that pretty much make men men. From a male's perspective, our job from a reproductive system standpoint is to do what? We do one thing, and we do it really, really well our whole lives. what do men do from a reproductive point of view?
They ejaculate. Is that the word?
Don't get me wrong, we do that. But that's,
Wait.
no, don't get me wrong, you're
No,
going
I did not mean that.
No, you didn't. There's nothing wrong with that word. If you open up a dictionary to the E's, ejaculate's there.
It
Fine.
means the sperm is coming up.
Yeah, but that's not the key function that men do. What is the thing that men do from a reproductive standpoint? We ejaculate it when the time comes.
Oh, you produce sperm.
We produce sperm
Yes.
by the millions, every day, all day. That's what we do. We make sperm and we deliver sperm. That's the job of the male reproductive system from an overall reproductive standpoint. And there's never a problem saying an anatomical word. So, yes, we ejaculate sperm, right? Ladies, so when we get to the male part of the reproductive system, it's really short and sweet. We produce the sperm, we deliver the sperm, and then from a reproductive standpoint, we're kind of out, right? We're done. Ladies, your reproductive system is far more complex, because not only do you have to receive said sperm, you have to produce your egg, ovulate your egg. You're the site where the sperm and the egg meet. That fertilized egg is then going to implant on your uterus and for the next 9 months turn into a fully functional human being. On top of that, you're the ones who deliver the baby. And then if all of that wasn't enough, you then can feed your child. All of that is female reproductive system. So we're talking about the ovaries and the fallopian tubes and the uterus, the cervix, vaginal canal, breast tissue, all of that, all of those organs that make ladies ladies. The female reproductive system is far more complex. I kid you not, if the chapter is this long, the male reproductive system part is like this, and the ladies, you're like this, all right? Much more complex, much more fascinating. Men are very clunky in that regard. Ladies, it's definitely really a cool thing to see all the things that the female reproductive system is capable of doing. And that'll be how we end our semester. Everybody cool with the organ systems? Good. With regards to maintaining life, the chapter now talks about how we maintain life. There's a handful of things that are necessary for the body to be able to maintain life. And as we talk through each of the different chapters, we're going to show you, or hopefully show you, how each of the different organ systems helps us to do at least some of the following things. All right, everything from maintaining boundaries. And for us to be able to thrive and survive and maintain life, we have to be able to maintain boundaries. The stomach has to be the stomach. The liver has to be the liver. We can't combine the two. We have to be able to maintain a boundary with regards to our skin so that whatever's outside stays out, whatever's inside stays in. Right? Otherwise, we can't thrive. We have to be able to move, not only physically move, but we have to be able to move things within the body. If your heart stops pumping, you are no longer moving blood in your body. You will pass away. Right? It's not a matter of if, it's how long. Right? If your digestive system stops moving things along the digestive system, you'll never reap the nutrients that you need to survive. You will starve to death. 2 weeks, that's all you got, right, if you stop digesting. So we have to be able to continually move things through the body. We have to be responsive. We have to have the ability of being able to sense changes that happen to the body and react. If we don't have receptors in our skin that detect heat, and we don't sweat as a result, we'll overheat. Your body temperature can't go much past 105 and you function in any capacity. We can't get any lower than maybe 93 without losing function either. We have to be able to react to the changes that happen around the body. We have to be able to break down materials and absorb nutrients. We call this digestion. Otherwise, it doesn't matter how much you eat, you'll never gain anything from it. Right? You'll never be able to actually bring it to your cells. Our cells need to be able to function, which is the definition of metabolism. When we think of the word metabolism, we think of, if I have a high metabolism, I'm skinny. If I have a slow metabolism, I'm heavier set. And that's one definition of metabolism. But from our class's definition of metabolism, what we're actually talking about is how a cell functions. A cell's function is its metabolism. And if cells don't function properly, the tissue can't function properly. And if the tissue doesn't function properly, the organ doesn't function properly. If an organ doesn't function properly, the organ system doesn't function properly, and a domino effect of bad will slowly occur. Excretion, we've got to be able to get rid of materials that don't belong in the body. And there are three primary ways that we excrete materials. One is defecation, 2 is urination, and 3 is sweating. Those are the 3 key ways we get rid of bad materials in the body, or waste materials in the body. And without that, we will get inundated with materials that we don't want. All right? There's a reason why we defecate, there's a reason why we urinate, there's a reason why we sweat in our underarms and groin area. It's to get rid of things that the body doesn't want or need. We need to be able to reproduce. And by this, I don't mean make babies. All right? I'm not talking about sex here. What I'm talking about instead is we need to be able to reproduce cells. Everybody here has cut themselves. Everybody here has done some damage to their body. And if we can't reproduce the cells that were damaged, well, then how can we expect that tissue to function properly? All right, if you cut your skin and now you have an opening where bacteria and viruses and funguses and all kinds of things can get into the body, we can't expect to stay healthy. We have to be able to find a way of reproducing on a cellular level to repair tissues that are damaged. Growth, we need to get bigger. All right, we can't. And by bigger, I'm talking about we need to be able to expand upon the organs, organ systems, organism level that we are to become fully functioning adults. With regards to survival needs, things that we need in order to make all of these necessary life functions happen, first and foremost, we need nutrients. I don't care how you eat. I don't care if you're a vegan. I don't care if you love nothing more than to eat meat all day long. Regardless of how you eat, what your diet is, you need to take in nutrients. And there are 5 very important nutrients that you have to have. You have to have protein, you have to have sugars or carbohydrates, you have to have fats, you have to have vitamins, and you have to have minerals. On top of that, we need to include water. We have to have water as well. But the 5 key nutrients, carbs, proteins, lipids, vitamins, and minerals. We can argue all day long about what percentage of each you should ingest, but the one thing you can't argue is that you need all 5 of them, because we use all 5 of these for various functions in the body, whether it's a protective function, a metabolism function. These are key. We need oxygen. No oxygen, you're not going to survive, right? We have to breathe in oxygen, get rid of carbon dioxide. We need water. We are primarily made up of water. Depending on the textbook, anywhere from 60 to 80% of our body is made up of water. The fact of the matter is we are primarily made up of water. And without it, we don't survive. We use a water for a sundry of things. Any fluid in your body is primarily made up of water. So we have it just for the fluids alone, we need water. But we use water also with a lot of our chemical reactions that we do in the body. We need a normal body temperature. 98.6 is that normal body temperature. We have to maintain that in order for us to function efficiently. We get too hot, we get too cold, we don't function properly. And as a result, the longer you stay out of function, the more likely you are to become diseased. And then we need atmospheric pressure. This is especially important for us to breathe in and breathe out. What's the one part of our country where the atmospheric pressure alters pretty significantly, and as a result, the more you try to do activity-wise, the harder it is to bring in oxygen and get rid of carbon dioxide.
Mountains?
The mountains, what city in particular is commonly linked to it?
Colorado.
Mile High Stadiums in what city? No football fans in the house? Denver, right? So we think about Denver, Colorado, right? Denver is a mile above sea level. Or yeah, Mile High Stadium is a mile high, it's a mile above sea level. The higher the elevation, the more atmospheric pressure that's placed upon our body. The higher the atmospheric pressure, the harder it is to bring in oxygen, the harder it is to get rid of carbon dioxide, right? The lower the elevation, the easier it is. So atmospheric pressure does play a big role in our abilities to oxygenate our body. So obviously we want to keep that in mind as well from a survival need. The book then talks about a very important concept. This is the concept of homeostasis. Homeostasis is a concept we're going to talk about kind of again and again and again as we go through every organ system. Every organ system, in part, plays a role in maintaining a concept called homeostasis. And homeostasis is simply defined as the maintenance of a relatively stable internal condition, which is a very bland and broad definition. Another way of putting it is that our body has a series of normals, and we need to maintain those normals in order for us to survive. What's normal body temperature? 98.6, right? If your body temperature is 102, what's the first thought you have in your head? I have a fever, but what does a fever signify? You're sick, right? If you had 102 fever right now, you'd be thinking, oh darn it, I'm sick, right? But if I took your temperature right now and I said you're 98.6, would any of you think that you're sick? No, right? You have a normal body temperature. If it goes too high, we're diseased. If it goes too low, we're diseased. Our body does whatever it can to maintain 98.6. We sweat, we shiver, we do all kinds of things to make sure we maintain 98.6 because we know our body functions optimally at 98.6. If I took your blood pressure, what blood pressure reading are you hoping I read? 120 over 80, right? And if you're 120 over 80, that tells us that your heart, pressure-wise, is doing fine, right? If your blood pressure is 150 over 100, what are you thinking? You have high blood pressure, which is a sign of heart disease, right? Sign that your heart's not functioning properly, right? Our bodies do whatever it can to maintain normal blood pressure. Respiratory rate, we're supposed to breathe anywhere from 60, or our pulse rate rather, is supposed to be anywhere from 60 to 90 or 100 beats a minute, right? If our resting pulse rate is too high, that's a sign our heart's working too hard. It's a disease. If it's beating too low, equally problematic, right? So that 60 to 90 we'd call homeostasis. 120 over 80 is homeostasis. And as we go through each of the different organ systems, we're going to talk about homeostatic numbers or homeostatic situations that organ system helps to maintain. The longer we stay at homeostasis, the longer we stay healthy. The minute we deviate from homeostasis, the more likely we are and the closer we get to being diseased. Does that make sense? So the key to living a long, healthy, productive life is to maintain homeostasis. Our body's constantly trying to do it, but we usually have a good way of mucking it up. Whether it's things we do to our bodies, things we don't do to our bodies, like exercise, diet, whatever it might be. There's two main organ systems that play a huge role in maintaining homeostasis. The first one is our nervous system. The second one is our endocrine system. Our nervous system is really good at making very, very quick, fast, immediate changes to the body. The problem with the nervous system is those changes don't last that long. All right, so if our body starts to overheat, it's our brain that tells our skin to sweat. And it's a very quick, easy way to lower our body's temperature. If our heart's beating too fast, our brain will tell the heart to slow down, and the heart will slow down and get back to normal. The endocrine system, on the other hand, is the other system that helps to really maintain homeostasis in the body. The difference is the functions of hormones happens very slowly. All right, we saw you went through labor. How long was labor?
I'm sorry, I can't even on the spot. I get nervous, sorry.
Don't be nervous. You can't get this question wrong. You're the only one who has the right answer.
I was in labor actually for a few days because my son was early.
Few days.
Yeah.
So she was in labor for days, right? The endocrine system takes forever. I have 4 kids, right? 3 of them were induced, and with induction, it took 8 hours. 8 hours to get that kid out. One of them came naturally. He was like 10 or 11 hours, right? The endocrine system is what's in control of giving birth to a baby, right? It takes a long time to do. But unlike the nervous system, where its effects are very short-lived, the endocrine system's effects are very long-lived. So they take a while to get there, but once they start working, they will keep going and going and going until homeostasis is found. Does that make sense? So we use both of these organ systems to help us maintain overall body homeostasis. And again, the minute we disturb homeostasis, whatever that number is, the closer and closer we are to being diseased. And the more diseased we become, the more likely we are to perish. And so when we think about maintaining homeostasis, it requires three very important things. One is a receptor, the other is a control center, and the third is something called an effector. And the way this works is simple. In order for us to maintain homeostasis, and we'll pick an easy one, we'll pick body temperature. So as we walk outside and it's 110 degrees outside with the Houston summers, we have receptors in our skin that detect heat. And they also detect our internal body temperature going up, right? As our body temperature begins to rise, these receptors are sending signals to the brain saying our body temperature is getting hotter and hotter and hotter. Our brain is smart enough to know this isn't good for our overall health. So our brain will send a signal to the skin telling the skin to release water. And the more water we release, the more our body temperature drops. Does that make sense? So in this particular scenario or example, 98.6 is homeostasis. As we go outside in the hot summers of Houston, our body temperature goes up. It's just natural, right? So now 98.6 becomes 99, becomes 100. As it gets to a certain level, receptors, which are found in our skin, detect our body temperature going up. It will send a signal to our brain, which is the control center, to say, hey, look, our body temperature is going up. You got to do something about it. Our brain will determine what's going on and will tell some part of the body, the effector, to do something different to bring back homeostasis. We will tell the skin to release water, which lowers our body temperature, and we stop sweating once what occurs? We get back to 98.6. Once our body temperature gets back to 98.6, there's no need to sweat anymore, and we'll stop sweating. Or if we run out of water, right? If we run out of water, we can't sweat, right? In which case now we're dehydrated, now we got a bigger problem. And there's two different types of mechanisms that we utilize to maintain homeostasis. The first one's called a negative feedback, and the second one is called a positive feedback. The difference between the two is how our body gets us back to homeostasis. The first one, or a negative feedback loop, this is when homeostasis gets disrupted, and the way the body fixes it is by reversing whatever the initial problem is. So for example, as body temperature goes up, what we do is we reverse it and bring body temperature down. If our blood pressure goes up, the body fixes it by bringing blood pressure down. If our respiratory rate goes up, we fix it by bringing our respiratory rate down. We just reverse the initial problem. That's known as a negative feedback loop. A positive feedback loop occurs when whatever the initial problem is, we enhance it. So if something goes out of homeostasis, we make it worse to make it better. Does that make sense? There's only a couple good examples of a positive feedback loop. If I ever give you an example on a test and say, is this an example of a positive or a negative feedback loop, and you flat out don't know the answer, guess negative, and you'll be right 99% of the time. The best example of a positive feedback loop is labor. What is it that's happening abnormally during labor? What is happening to a woman's body that is non-homeostatic? What dilates? You're right, the cervix. What's happening that's abnormal in labor is the cervix is dilated. The cervix is ultimately at the base of the uterus and at the very, very distal end of the vaginal canal. And it's a donut. It's a donut of muscle and connective tissue, which normally is closed, right? But when the baby's pushing head down onto the cervix starts to dilate. The hole of that donut starts to get wider and wider, right? That's abnormal. That should not happen. There's no reason why a woman's cervix should stretch. So as it begins to stretch, the body sends a signal to the brain saying, hey, my cervix is stretching. Well, does the brain tell the cervix to contract or get wider? Tells it to get wider, right? And so how wide does the cervix have to get before mom starts to push? 10 centimeters, otherwise known as 3 fingers, right? About 3 fingers width. Once this happens, mama's got to start pushing, right? But the cervix, when it started to stretch, it went from no centimeters to a couple millimeters, to a couple more millimeters, to a couple more millimeters. And then the body starts kicking in, trying to make the cervix stretch more and more and more. It makes the initial problem worse, so that the baby can be born, and then the cervix goes back to homeostasis, which is not being stretched at all, correct? So that would be an example of a positive feedback loop. Everybody kosher with that concept? Good. The second half of this chapter, which is by far the more important part of this chapter, especially from a lab perspective, is talking about the anatomy, or the language of anatomy. Like I said in lecture today, anatomy and healthcare professionals have their own language. And if you're going to get into healthcare, you're going to have to learn the new language. It's how we communicate. You may not like it. It doesn't matter if you like it. It's happening anyway, right? And if you don't know anatomy language, you are never going to make it in healthcare, right? And it doesn't matter what type of healthcare you get into, right? You can go into MDs, you can become a nurse, go into radiology, you can become a chiropractor. We all use the same language, right? And believe it or not, the sooner you learn this language, the easier it is, A, to communicate with other professionals, B, the easier it is to understand the things that are happening, like when you read a radiology report or you start talking about diseases, understanding exactly what's going on. And then 3, it's going to make you sharper with regards to your diagnostic skills and your ability to do your job more efficiently. It's a good thing to learn, and the sooner you learn it, the better. When we think about anatomy language, we always start with the concept of anatomical position. And this guy is in anatomical position. His hands are down by his side, his palms are forward, toes are facing forward. We refer to this as anatomical position. This is utilized in order to better understand some of the directional terminologies and things of that nature. When we talk about directional terminology, I'm going to utilize these slides because they actually show the picture. There's a handful of terms that we use to describe relationships directionally within the body. And they're always going to be a series of opposites. So for example, we have the concept of superior and inferior. Superior simply means, it doesn't mean better, like if I'm superior at chest, that means I'm better at chest than you are. That's not what we're talking about here. Superior means closer to the head. Inferior means farther away from the head. So if I was to give you 2 points, like if I was to say my nose is blank to my chin, what term would be correct? My nose is superior to my chin because my nose is closer to the top of my head than my chin is, correct? Another way to use the same word is if, like, you were getting massaged and you're laying on your stomach and the therapist starts at your belt line and moves his or her hand towards your shoulders. They're moving their hand superiorly. Does that make sense? Because they're moving their hand towards the head. Or the converse of that is if I started at the shoulder blade and started moving down towards the belt line, I'm moving my hand inferiorly, right? So when we think about superior and inferior, superior simply means closer to the head or towards the head. Inferior means farther away from the head or closer to the feet, closer to the bottom of the torso. The next 2 are anterior and posterior, otherwise known as ventral and dorsal. Nobody uses cranial and caudal anymore. Anterior and ventral or posterior and dorsal. Anterior means closer to the front of the body. Posterior means closer to the back of the body. So my spine is posterior to my lungs. Does that make sense? My belly button is anterior to my small intestines because it's closer to the front of my body than my intestines are. We can also talk about this from the standpoint of emotion. Like if someone gets shot and they get shot in the back, that bullet goes from posterior to anterior. It moves anteriorly through the body. Or if it comes from the front, it goes posteriorly through the body. If I go from the front of my body and it goes out the back. Everybody kosher with that concept. The next one is medial, lateral, and intermediate. Medial means closer to the midline. Lateral means farther away from the midline. And the midline, if you think about a plumb line going right down the center of your body, that's your median line. My shoulder, if I was to compare my shoulder and my sternum to one another, my sternum would be medial to my shoulder, because my sternum is closer to the middle of my body than my shoulder is, right? Therefore, my shoulder is lateral to the sternum because it's further away from the midline. My ear is lateral to my eye. My eye is medial to my ear. Does that make sense? Because my eye is closer to the midline. Intermediate is if you're comparing three different things. So if we're comparing my sternum, my nipple, and my shoulder, my nipple is intermediate because it's in between the other two. Make sense? Proximal and distal. This is the one that you all screw up. Right? You all screw this one up. This one is the one, if anything is going to confuse you, it's going to be these two. Proximal and distal only refer to the extremities, arms and legs. And what we're comparing two things to is their location with regards to either the hip or the shoulder. So if I'm comparing my elbow to my wrist, my elbow is closer to the shoulder than my wrist is. Therefore, my elbow is medial to my wrist. My wrist is further away from my shoulder, so my wrist would be distal to my elbow. Does that make sense? Same thing in the lower extremity. My hip is now what we're comparing it to. So anything that's closer to the hip is proximal. Anything that's further away from the hip is distal. So my knee would be proximal to my toes, because my knee is closer to the hip than my toes are. What y'all, when they ask, they invariably ask proximal and distal on the first lab exam. And they know you're going to screw it up, that's why they ask it. What you all end up doing is putting superior and inferior instead of proximal and distal. The problem is, if I stand in this position, my elbow is closer to my shoulder than my wrist is, correct? So my elbow is proximal to my wrist, right? But it's also, in a way, superior to my wrist, is it not? But how about now? Now it's inferior. So inferior and superior don't work anymore. But distal and proximal still do, because my elbow, regardless of where my arm is still closer to my shoulder than my wrist is. So proximal and distal always stay true. Does that make sense? So when you think about proximal and distal, you're only talking about the extremity. And we're comparing things now to where they are with location to the shoulder or the hip.
So like your wrist to your elbow, the arm is underneath?
Yeah, well, yeah, no, that's actually a good call. Yeah, if you were to compare 3 points, like your elbow, your forearm, and your wrist, the forearm would be intermediate. It would still be intermediate. Although I will tell you this, in this class, that question is never asked. If they're going to ask an intermediate question, they're going to talk about something in the torso. They'll compare 3 points either on the face and head, or they'll compare something like 3 points on the torso. But yes, your point is still well taken. Yeah, if they go to an extremity, they're going to be talking proximal and distal. Superficial and deep. Superficial means closer to the surface of the body. Deep means closer to the core of the body. But for superficial and deep to work, whatever is superficial has to surround whatever is that is deep. So for example, my rib cage is superficial to my heart because my rib cage completely surrounds my heart, does it not? My heart is deep to my rib cage because it's completely surrounded by the rib cage. Where people make a mistake here is they'll ask you for 2 different structures and you'll put superficial and deep and it'll be wrong because it'll be medial and lateral. The difference between the two is if something is completely surrounded by something else, superficial and deep is what you need to use. If it's just side by side, medial and lateral is what needs to be used. Does that make sense? So typically what they'll ask with superficial and deep. They'll also talk about the rib cage and the lungs or heart within it. They'll talk about the cranium and the brain within it. Or they'll talk about, there's another one. There's a third one they ask from time to time. Oh, skin. Skin and anything underneath it. If they're talking about skin, skin is the quintessential superficial because it surrounds everything, right? So with this one, keep in mind, we're talking about something that surrounds another structure. Are we kosher with directional terms? Any questions on the directional terms? You have to practice them. And again, the best way to practice them, because 99.9% of the questions that are asked with regards to directional terms will look just like so. Where they will take two structures of the body and they'll compare them to one another. They'll say the lungs are blank to the rib cage. And they'll say, put in the directional term that makes the most sense. Or they'll say, the eye is blank to the ear. The belly button is blank to the chin. The elbow is blank to the wrist. And they're going to look for the directional term that completes the sentence. On my test, I will do the exact same thing. I will give you maybe 2 or 3 examples of where I compare two structures. The difference is I'll give you a multiple choice. I'll give you multiple choices. The lab exam won't. Yes, ma'am.
For distal, is it always going to be close to the shoulder?
Proximal is always closer to the shoulder. Yeah, this proximal is either closest to the shoulder or closest to the hip, depending on which extremity you're talking about. If you're talking about the arm, we're comparing it to the shoulder. If you're talking about the leg, we're comparing it to the hip. Proximal is closer to, distal is further away. The next two pictures, this one and this one, these are talking about anatomical landmarks. There is nothing to teach here. This is either you know these landmarks or you don't know these landmarks. And these are one of those things where you're just going to have to study these, and you're going to have to practice these and get used to all these different parts of the body. And the great part about this particular picture, and this is generally the picture that they use on your lab exam, is it's nicely segmented by these little white lines. So you can see where, when they're talking about the antebrachium, for example, they're pointing here, so it's obviously between this white line and this white line. So you know it's the forearm they're talking about. These are all terminologies you're just going to have to learn. All right, you're going to have to go home. My recommendation is you print out this picture and this picture with the words, and then since this is a PowerPoint, you can remove all the words but leave all the letters, and then practice. Just practice till you get good at it. Because ultimately, there's two advantages to learning these terms as quickly as possible. One, they're just going to ask them on the test. All right, there's going to be test questions on your first lab exam where they're going to have this guy on a picture. They're going to be pointing to one of these sections, and they're going to say, name the anatomical term shown here. And if they're pointing to the belly button, I'm looking for umbilical. If they're pointing to the knee, in front of the knee, I'm looking for patellar. If they're pointing to the chest, I'm looking for pectoral. If they're pointing to the point of the shoulder, I'm looking for acromial. They're going to ask a handful of questions on these. There's no way to really teach it. You just have to learn them, all right? The other reason why it's important to learn these terminologies is when we get further and further into the class and we start talking about the different organ systems, these terms are going to come back and haunt you. So for example, what's the name of the muscle found right here? Your pectoralis major. Pectoral is chest. So if you know that pectoral is chest, it should make perfect sense that the pectoralis major is a chest muscle, right? There's a bone on the tip of your shoulder called the acromion. Well, the tip of the shoulder is called the acromial region. The top of the shoulder is called the deltoid region. What muscle is located right here? Your deltoid muscle. All right, these terms are going to come back and haunt you anyway. What you're going to find is that a lot of these terms, as we get further and further into different organ systems, whether it's the skeletal system, the muscular system in particular, but even some of the other systems to boot, what you're going to learn is that these terms are just going to come back again and again and again. So the sooner you learn them, the easier it's going to be to absorb and digest the material that we learn later on down the road. So again, with regards to these different terminologies, you gotta start learning these as quickly as possible. Because they will be on your first lab exam for sure. Planes of the body. When we talk about planes of the body, any rad techs in the house or people going into radiology fields of any kind? So for all my rad techs, these are going to be something that these are going to be terminologies that you play around with all day long and twice on Sundays. When we talk about planes of the body, we talk about our ability to segment the body into either left and right half, a superior and inferior half, or an anterior and posterior half, front and back. And again, like we see on the pictures on the bottom of the screen, these are varieties of radiological tests, whether they're CT scans or MRIs or PET scans, things of that nature, where we utilize these concepts to subdivide and dissect the body in order to either search for disease or diagnose problems that might be occurring in the body. When we think about the median plane or mid-sagittal plane, the sagittal plane is a plane that separates the body into a left and a right half. And it comes in two forms. There's mid-sagittal, and I think all the words are here for you. Yeah, here's all the different words for you back here. So when we think about mid-sagittal means we are dividing the body into an equal left and right half, which we can do. If we go right down the center, we're dividing the body into an equal left and right half. A good example of mid-sagittal would be half head down. Somewhere out there, there's an equal left side to this guy's head that looks exactly like the right, just it's the left instead of the right, correct? So this represents a mid-sagittal cut. On the same token though, if I have that sagittal cut and it's not right down the center, we just call it a sagittal or a parasagittal cut. The next one, letter B. This is called a frontal or coronal plane. Either one is good, frontal or coronal, so learn both terms. Frontal and coronal planes separate the body into an anterior and posterior half. And then last but not least is our transverse plane, otherwise known as an axial plane, otherwise known as a horizontal plane. And this plane separates the body into a superior and inferior half. And again, in healthcare, where we see this used most commonly is when we're talking about anything in the radiology parts of the world, whether it's an x-ray, whether it's a MRI, a CT scan, a PET scan, all the different scans of the body, separate the body into a series of planes so that we can ultimately get a 3D view of what's going on inside the body. Fair enough? We talk about body cavities, which is the next section. Body cavities are ultimately, we separate the body into a series of cavities, and within these cavities, we have all of the organs of our body. Everything we see here in yellow is the dorsal cavity or the dorsal cavities of the body. Everything that we see here in this pinkish reddish color are the ventral or the anterior cavities of the body. When we think about the cavities on the dorsal side, we have the cranial cavity and our spinal cavity. The cranial cavity is where we store our what? Brain. Spinal cavity is where we store our what? Spinal cord. When we think about the cavities in the front of our body has three very distinct cavities. One is our thoracic cavity, our abdominal cavity, and our pelvic cavity. The difference, the separating factor between the thoracic cavity and our abdominal cavity is a muscle called our diaphragm, which ultimately sits about right here. In our thoracic cavity, which is everything up here, there's two major organs. What are they?
Lungs and heart.
Lungs and heart, right? So if they ask you on the test, name an organ that's found in the thoracic cavity, say lungs or heart. Also within there is our esophagus, our trachea, our bronchi. So as we get further along, there's other organs that are in there as well. Below the diaphragm and to about our belt line is our abdominal cavity. And in the abdominal cavity is a whole series of organs as well. So what organs are in our abdominal cavity? Large and small intestine for sure. Stomach, pancreas, kidneys, all both of them, liver, gallbladder, spleen. These are all the organs in our abdominal cavity. And as we dissect our rats, either Thursday or Tuesday of next week, we're going to look in the abdominal cavity and see all the different organs that are contained within. As we get below the belt line, we have our pelvic cavity. And in our pelvic cavity, there's one organ that all of us share, and that would be our what? Hmm? Don't get me wrong, yeah, our rectum is there, so I'll give you rectum, but there's another one I was thinking of. Bladder. So we both have bladders, right? Men and women both have bladders. What are some of the organs that only females have that are found within the pelvic cavity? Uterus, ovaries, sure, fallopian tubes, cervix, vaginal canal. All those are female-related organs that are found only in pelvic cavity. As for the men, in the pelvic cavity, prostate, vas deferens, the majority of our urethra, all found within the pelvic cavity for the gentleman. So the big thing here is, can you name the cavity? But more importantly, by the time we get to the first lab exam, and we're going to do this through other labs, you'll be able to easily name at least some of the organs that are found within each of these cavities. And when we think about the answers to all those questions, we have them here. A lot of times you'll see slides that have all the pictures or have all the answers, and then what I'll use is the picture to describe what's on those slides. I find no one likes to just have someone read a slide to them, right? I know I hated that, so I use the picture instead. The last key concept that we're going to talk about, and we're pretty much close to being done, is we ultimately can segment our abdominal cavity into a series of quadrants. And these quadrants ultimately give us a little bit of, just helps us to organize how things are stacked within these cavities. And the one part of our one cavity that we tend to segment the most is our abdominal cavity. Now there's two ways we can do it. We can do it the easy, correct way, or we can do it the difficult, incorrect way. So which way do you think we're going to learn?
Easy correct way.
Bull crap. We're going to learn the difficult, incorrect way. All right? Nobody uses this system in healthcare. Everybody uses this system. Right? Whether you're a gastrologist, whether you are an internal medicine doc, whether you are a general surgeon, everybody uses the quadrant system, which means you have a left upper, right lower, left lower quadrant. Everything revolves around the belly button. Having said that, that's not the way we teach it here. We teach it this way. We separate the abdominal cavity into 9 segments. So you want to study the 9 segments, and you want to make sure that you know the organs that are contained within each of these 9 segments. So, if we are to break down our abdominal cavity into a board something like so, dead center in the middle is our belly button. And this quadrant is known as the umbilical region. What major organ, and you can cheat by looking at the picture on the right, is found in our umbilical region? This is where we find our small intestine. Above it and below it. So above it, this is called the epigastric region. And down here we call this the hypogastric region. To the left and right we have the lumbar region. This would be the right lumbar, this would be the left lumbar. R circle is right, L circle is left. To either side, are the hypochondriac regions. And on either side here, I like to call them the inguinal, but iliac is equally as fine, but I'm always going to call them the inguinal. This, of course, being the left side. This, of course, being the right. So we've effectively subdivided our abdominal cavity into 9 sections. What key organs are going to be found in this left hypochondriac region? So what organs are found here?
Diaphragm and stomach.
Diaphragm is here. So the diaphragm is kind of the roof of the whole thing. So it doesn't really fall into one of the segments. So what organs are you going to find up in here?
Liver.
Nope, that's over here.
Parts of the stomach.
Stomach is one.
Diaphragm.
Again, diaphragm is going to be the roof of this 9 segments. What other major organ do we find over here? Spleen. Now we're talking over here. What's over here? Now we're talking about the liver. And there's another very important organ over here, which is just underneath the liver. It's green. Gallbladder. And in the center, there's part of the stomach. And in the center, there's part of the liver. Both of these organs kind of bleed into the epigastric region. As we can see here, here's the liver coming up top, and here's the stomach coming down low. Everybody with me? When we think about the lumbar region, 2 organs. We have 2 of them, one on each side of our cavity. Kidneys. Both our lumbar regions, we're going to find kidneys. What was the other one you said?
Large intestine.
And the large intestine. Which leaves us with our inguinal region. Oh, well, we have 3 seconds left. So what's in the hypogastric region? Something that we all have in common. Bladder. This is where we're going to find our bladder. For ladies, this is where you're going to find your uterus. For gentlemen, this is where we're going to find our prostate. And in the inguinal regions, we're going to find large intestine on both sides. Ladies, this is where you're going to find your ovaries. So what this 9-segment system ultimately does is it helps to break up our abdominal cavity, and now we can understand where we're going to find each of these different organs of the body. Again, this is not how healthcare professionals do not use this system. This is more of a tool that the school makes us teach you guys so that you better understand where the organs are located. Keep in mind that in healthcare we just use the quadrants and it's 1,000 times easier. All right, this is pretty much the end of chapter 1. We will start chemistry on Thursday. So on Thursday we will start chemistry. I can